Kidney-damaging habits. Kidneys are organs that work tirelessly every day to filter blood, remove toxins, and maintain the body's fluid balance. But did you know that some of our habits can slowly damage our kidneys? What are the habits that can damage our kidneys? This is what the doctor says. Kidneys can quickly become damaged, or their function can decline if we engage in these habits. Not drinking enough water. Our kidneys work like fluid filters that need to stay wet to filter impurities properly. Imagine if this filter were dry or clogged, the impurities would build up and damage the system. If we don't drink enough, our kidneys have difficulty eliminating waste, which can increase the risk of kidney stones and make their work harder. We must drink at least 2 to 3 liters of water per day, which is equivalent to 3 to 5 bottles of 600 milliliter mineral water, or about 10 to 15 glasses. If you use a larger 1.5 liter bottle, then 1 to 2 bottles per day is enough. Remember, do not replace water intake with soda or sugary drinks because they can actually worsen the burden on the kidneys. Excessive salt consumption. Excessive salt consumption makes the kidneys work extra hard to eliminate sodium. But if there's too much, the kidneys can become overwhelmed. As a result, sodium builds up in the blood, attracting more fluid and causing blood pressure to rise. This high blood pressure can damage blood vessels in the kidneys, gradually reducing their function. To prevent this, we should reduce our intake of salty snacks, instant foods, and fast food. Instead, use natural seasonings like garlic, pepper, or spices to add flavor without relying on salt. Make it a habit to read the nutrition label on packaging so we can choose products with lower sodium content. Cooking at home is also the best solution because we can control the amount of salt used so our kidneys stay healthy and work optimally. Frequent consumption of soda and alcohol. Dark-colored sodas generally contain high levels of phosphate, which, if excessive, can disrupt mineral balance and accelerate kidney damage. Meanwhile, clear sodas may be lower in phosphate but still contain high sugar or artificial sweeteners. These can increase the risk of obesity, diabetes, and high blood pressure. All of these contribute to kidney damage in the long run. Drinking alcohol can have a negative impact on the kidneys because it causes dehydration and worsens high blood pressure. When we drink alcohol, our bodies lose more fluids because alcohol is a diuretic, which makes us urinate more frequently. As a result, the kidneys have to work harder to filter blood and maintain fluid balance. If dehydration occurs continuously, the kidneys can become stressed and their function can decline. In addition, consuming large amounts of alcohol can increase blood pressure, which can damage the kidneys and liver. Therefore, it's best to reduce or avoid drinking alcohol. Instead, choose plain water to keep kidney function optimal. Excessive use of painkillers. Painkillers like ibuprofen, if taken too often or for a long time, can damage the kidneys. This condition is known as analgesic nephropathy. Just like an engine that is constantly forced to work without rest, kidneys that are exposed to these medications too often can experience a decline in function. These painkillers also have side effects that interfere with blood flow to the kidneys, making it difficult for them to filter waste optimally, and in the long run, can lead to kidney failure. To keep kidneys healthy, use painkillers only when absolutely necessary and in the dosage recommended by a doctor. High-protein diet and ultra-processed foods. Protein consumption is important for the body, but if it's excessive, especially from red meat and high-protein supplements, the kidneys have to work harder to filter waste products from protein metabolism. In addition, ultra-processed foods like sausages, nuggets, and instant noodles often contain high levels of phosphate and sodium, which can disrupt mineral balance in the body and increase blood pressure, ultimately affecting kidney function. To keep kidneys healthy, limit excessive red meat consumption and processed foods. Instead, choose kidney-friendly protein sources like fish, tofu, and tempeh. If you need more protein, consult a doctor or nutritionist for recommendations that are appropriate for your body's condition. Frequent consumption of sugary drinks. Sugary drinks like boba, packaged milk tea, or coffee with lots of sugar syrup can increase the risk of diabetes and obesity, which are 2 major causes of chronic kidney disease. When blood sugar levels are consistently high, the kidneys have to work extra hard to filter excess sugar from the blood. If this condition persists for a long time, the kidneys can experience permanent damage. Drinks like boba often contain high sugar. One glass can contain 40 to 60 grams of sugar, far exceeding the recommended sugar intake limits set by the World Health Organization, which is around 25 grams for women and 36 grams for men. Holding back urination. Too often. Delaying urination too often can cause urine to remain in the bladder for longer, increasing the risk of urinary tract infections, UTIs. If these infections are not addressed, they can spread and ascend to the kidneys, potentially causing pyelonephritis, a kidney infection that can damage the kidney tissue. In addition, this habit can also increase pressure inside the kidneys, making them work harder than they should. Lack of sleep. During sleep, the body repairs cells, including those in the kidneys. Lack of sleep can increase levels of stress hormones like cortisol, which, in the long run, can increase blood pressure and damage blood vessels in the kidneys. In addition, lack of sleep is also linked to impaired glucose metabolism, which can accelerate the risk of diabetes, a major cause of chronic kidney disease. Smoking habit. Smoking is not only harmful to the lungs but can also damage the kidneys. Nicotine and other chemicals in cigarettes constrict blood vessels, reducing blood flow to the kidneys, and in the long run, this can lead to progressive kidney damage and increase the risk of high blood pressure and kidney failure. Excessive consumption of foods. High in oxalate. Foods like spinach, chocolate, beets, nuts, and black tea contain oxalate, a compound that can bind to calcium and form kidney stones. If consumed excessively without sufficient calcium balance, oxalate can precipitate in the kidneys and increase the risk of kidney stone formation. It's best to consume these foods along with natural calcium sources like milk, cheese, or yogurt, because calcium can help bind oxalate in the intestines before it reaches the kidneys. Excessive consumption of energy drinks and caffeine. Energy drinks and large amounts of coffee can increase blood pressure and cause dehydration. Excessive caffeine can also trigger an increase in calcium excretion in urine, which, in the long run, can contribute to kidney stone formation. Limit caffeine intake to no more than 400 milligrams per day, or about 4 cups of coffee. If you need extra energy, try getting enough sleep and consuming nutritious foods as an alternative. Frequent use of herbal supplements and high-protein supplements. Without supervision, many herbal supplements that have not been tested for safety can contain substances that are toxic to the kidneys. In addition, excessive protein supplements like whey protein or creatine in high doses can burden the kidneys, especially for those who already have kidney problems. Before taking herbal or high-protein supplements, consult a doctor or nutritionist. Use them in moderate doses and in balance with your body's needs. So, there you have it, some habits that can damage our kidneys. Let's start today, take care of our kidneys, drink enough plain water, and reduce our consumption of foods or drinks high in sugar and sodium starting today. Thank you.